A chronic subdural hematoma is an area of bleeding along the outside of the brain underneath the covering of the brain. The covering of the brain is called the dura, somewhat like a little leather casing for the brain. And what can happen as we age, our brain shrinks in volume so that space becomes larger. And with the minor trauma, sometimes not even with the minor trauma, you can have leakage of blood into that space where it causes pressure on the brain itself. Typically, symptoms associated with chronic subdural hematomas are headaches, nausea, vomiting sometimes, altered mentation sometimes, weakness, and even seizures. The way that it's typically diagnosed is that your clinician has some index of suspicion for you having a subdural hematoma, and they order imaging of the brain, whether that be by way of CAT scan or MRI. There are two broad categories for treatment of subdural hematomas, one of which is open surgery by way of placing small, what we call burr holes, and washing out the subdural, or turning a small craniotomy in the skull and washing out the subdural and replacing that bone. Typically in conjunction with that, we do a procedure called a middle meningeal artery embolization, or MMA-EMBO, where we block off the leaking blood vessels with special medical grade glue through a minimally invasive fashion. Chronic subdural hematomas can cause any number of issues, most notably of which is progressive decline in mental status, seizures that are difficult to control, weakness in the arms and legs lead to difficulty walking. The key issue is finding the subdural quickly and intervening on it when appropriate. So we here at Tulane neuroscientists have experts who are very well versed in all aspects of diagnosing, management, and treatment of chronic subdural hematomas.